Okay, let's discuss the 5 transporting points. HESI point, Kidney 10, YINGU, Yin Valley. Location at the medial end of the popliteal crest between the tendons of the semimembranosus and semitendinosus muscle on the level of the knee joint space. How to find? With the knee flexed less than 90 degrees, ask the patient to press their heel against the treatment couch so that the two tendons will become more pronounced in the popliteal crease. From a medial direction, kidney 10 is located in a small gap anterior to the more prominent tendon of the semitendinosus muscle and posterior to the less well-defined tendon of the semimembranosus muscle. Bladder 40 is located on the same level in the center of the popliteal crease. Needling, needle 1 to 1.5 tune vertically from a dorsomedial aspect towards the tibial tuberosity. Avoid puncturing the tendon. Actions, indications, drain damp heat from the lower burner and benefits the kidneys, opens the channel. Special features is C point, bend point, 5 basis point for recurring urinary disorder with kidney yin deficiency. It resolves dampness from the lower burner, hypogastric pain and fullness, abdominal distension and pain, difficult urination, turbid urine, painful urination. Tonifies kidney yin for in backache, tinnitus, deafness, night sweating, dark urine, dry throat. Kidney 10 has 2 main uses. First of all, in common with the other 2 yin C points around the knee, spleen 9 and liver 8, it resolves dampness from the lower burner and is therefore used for urinary symptoms such as difficulty, pain, and frequent urination. Secondly, this point can also be used to nourish kidney yin. In this respect, it differs from kidney 6 insofar as the latter does not only nourish kidney yin, but it specifically sends yin up, especially to the throat and eyes. It is therefore the best point to use to nourish kidney yin when there is a dry throat and eyes. Kidney 9 also nourishes kidney yin and is better than kidney 10 when there are mental emotional problems such as anxiety and insomnia. Kidney 10 is the HESI and water point of the kidney channel. It shares with the HESI point of the other leg yin channels the common function of clearing dampness and damp heat, especially from the lower jaw. Liver 8 primarily acts on the genital system, dominated by the liver channel, and spleen 9, by virtue of the intimate relationship between the spleen and dampness, is able to treat all dampness disorders of the lower jaw. Kidney 10 predominantly clears damp heat from the genitourinary system and is indicated for difficult or urgent urination, dark urine, leukorrhea, and genital itching. Accumulation of damp heat may impede the smooth flow of qi and give rise to pain, reflected in the traditional saying, "Without movement, there is pain. With movement, there is no pain." Kidney 10 is indicated for pain on urination, urgent urination with pain spreading to the thighs, pain of the genitals, periumbilical pain, and hypogastric pain radiating to the inner thigh and genitals. While the impotence is most commonly due to decline of Ming-Men fire, it may also be due to accumulation of damp heat, which gives rise to flaccidity. Damp heat impotence may arise from liver channel damp heat or spleen damp heat, which pours down to the genitals, or from repeated attack of exterior damp heat to the bladder. Kidney 10 is primarily indicated for such excessive patterns of damp heat impotence. In females, damp heat may give rise to uterine bleeding and difficult conception, both indications for kidney 10. There is a close relationship between the lower jaw, damp heat, and kidney deficiency. If kidney deficiency gives rise to heel, This may combine with dampness to form damp heat. While prolonged damp heat will consume first kidney yin, then kidney yang. This dual pattern of kidney deficiency and damp heat is commonly encountered in clinical practice, especially in patients with repeated urinary disorders. Due to its secondary action of benefiting the kidneys, kidney 10 is indicated when these two patterns coexist. Water point, horary point, 5 to 7 p.m., seasonal horary point, winter, HC, antique autumn point, endocrine point. Revitalize, shakes up, and cleanses this official, and thus the fluid secretion, especially when used between 5 to 7 p.m. For itching and dampness around the scrotum or vagina, for all types of vaginal discharge, and for excessive or painful urination. Excellent for knee trouble and injury. Strengthens weak knees in general. If secretions or blood are overheating, they can be taken through this valley to cool down and calm down. Consider when there is blood in the urine. Comes the raging seas of excessive fear. From kidney 10, the deep pathway passes through to the coccyx and do1 and then up the spine before passing forward to REN 3 and 4. Connects to the root of the tongue. Thank you for your attention.
Let's now discuss gallbladder 41. ZULINQI, foot governor of tears. Located in the depression at the junction of the shafts and the bases of the fourth and fifth metatarsal bones, lateral to the tendon of the extensor digitorum longus muscle. How to find? Palpate for the distinct tuberosity of the fifth metatarsal bone on the lateral aspect of the midfoot. With the palpating finger, glide on from the tuberosity to the dorsum of the foot into the groove between the fourth and fifth metatarsal bones. There, palpate in a distal direction. Gallbladder 41 is located at the junction of the heads and the shafts of the two bones. Or ask the patient to abduct their toes so that the branch of the tendon of the extensor digitorum longus muscle extending to the little toe becomes more pronounced. Then palpate in the groove between the fourth and fifth metatarsal bones from distal to proximal to where the tendon crosses the groove. GB42 is located medial or anterior to it, while GB41 is located in the depression lateral or posterior to the tendon. Needling perpendicularly or obliquely approximately 0.3 to 0.8 zoom. Actions, indications. GB41 spreads liver chi, benefits the thorax and the lateral costal region, transforms phlegm, dissipates nodules, benefits the breasts, clears the head, benefits the eyes. Special features, shoestring point, wood point, opening point of the thigh, pen point, 5 faces, exit point. GB41 subdues liver yang for headache, dizziness, blurred vision, promotes the smooth flow of liver chi for hypochondrial distension and pain, fullness of the chest, clears heat in the gallbladder channel, so very effective for red, swollen, and painful eyes, pain in the outer canthus, dry eyes, benefits the breasts, breast distension and pain, breast lumps, breast abscess, resolves damp heat and regulates the girdle vessel for leukorrhea. GB41 is an indispensable point to spread the liver chi, especially when chi stagnation manifests along the course of the gallbladder channel, and this action underpins all the indications of this point. Although the primary cause of liver chi stagnation is emotional, it may manifest both with physical symptoms and emotional changes. GB41 predominantly treats the physical symptoms of liver chi stagnation, namely distension, pressure, and pain along the gallbladder channel in the chest, head, eyes, breast, lateral costal region, and axilla. GB41 is the confluent point of the girdling vessel, which encircles the waist and binds the penetrating and conception vessels and the kidney, liver, and spleen channels, all of which Channels influence the menstrual cycle. Furthermore, the gallbladder primary channel descends through the chest region. The gallbladder sinew channel links with the breast, and the nipples are ascribed to the liver channel. GB41 is particularly used, therefore, in situations where liver qi stagnation impairs the regularity of the menstrual cycle, and more especially for symptoms of stagnant qi, such as distension and pain of the breast and headache which precede the menstrual period. GB41 is also indicated for breast abscess and is combined in a modern prescription with GB37 to stop lactation. After needling, moxibustion is applied to the points for 10 minutes. GB41 is exit point, wood point, horary point from 11 p.m. to 1 a.m. Seasonal horary point, spring. Crossing point of GB and bladder, shoestream antique summer point. Opening point of Tai Mai or girdle vessel, coupling point of Yang Wei Mai. Wood within wood crystallizes the essence of wood and helps with decision-making, clarity, judgment, lack of courage, or frustration. Aids the smooth flow of liver energy. It connects to liver 1, important for eyes and vision, enabling a person to grow and move forward in their life. Can release emotional blocks, particularly anger, and as a result, may also release tears. All the resonances of wood are heightened with this point. Wood within wood, the essence of wood, spring, the east, birth, growth, and upward and outward expansion. It brings clarity, strengthens timid gallbladder, and aids indecision and clouded judgment. When someone is frequently angry from exhaustion, or when anger and frustration, a sense of being thwarted by life, has led to stagnation and resentment, this point revitalizes the body, mind, and spirit, and can help turn the inward-looking nature of wood depression back towards the outside world, imparting a sense of loosening oppression. It can promote an emotional release through tears. This is also an extremely important point for promoting the smooth flow of liver qi, fullness of the chest with apparent shortness of breath, rebellious qi, lateral costal pain, and is effective for disorders of the upper body where there are problems from stagnation of liver fire or liver yang rising. Red eyes, visual disorders, dizziness, headache, tinnitus. Its role as an exit point and a distal point also helps clear the meridian and pull qi down from the head. Thank you for your attention.
Let's discuss the extra points. Yiming, eye brightening, EXHN14, Bailao, 100 taxation, EXHN15. Location at the junction of the head and the occiput, posterior to the mastoid bone. How to find? EXHN14 is located on a line connecting TB17 below the earlobe between the maxilla and the mastoid, and GB20 at the junction of the occiput and the neck in the center of the dorsolateral depression. From TB17, measure 1 tune towards the posterior and there locate Yiming posterior to the mastoid. Located slightly superior and posterior to Yiming is EXHN amnion in the corner between the mastoid and occiput. Needling vertically 0.5 to 1 tune. Actions, indication, disorder of the eyes and ears, dizziness, insomnia. Yiming, location 1 tune posterior to Yifeng, TE17. Indications, eye disease, tinnitus, insomnia. Method, puncture perpendicularly 0.5 to 0.8 inch. 100 taxation, EXHN15. Bailao, location 2 tune superior to the lower border of the spinous process of the 7th cervical vertebra, C7, and 1 tune lateral to the midline. How to find? For locating C7, DO14 is located below the spinous process of C7. From there, measure 2 tune in a superior and 1 tune in a lateral direction. Needling vertically 0.5 to 0.8 June. Action indication dispels wind and dampness, opens the channel. Indication, scrofula, cough, dyspnea, lung consumption, night sweating, spontaneous sweating, steaming bone disorder with tidal fever, stiffness and pain of the neck. This point was first discussed in the compilation of Acupuncture and Moxibustion. Note that the name Bailao 100 taxation is also an alternative name for DO14. Thank you for your attention.
Let's discuss Bladder 60, Kunlun Mountains. Bladder 60 is located in the depression on the line connecting the Achilles tendon and the highest prominence of the lateral malleolus. How to find? Locate the highest prominence of the lateral malleolus. From there, palpate horizontally towards the Achilles tendon and locate bladder 60 in a depression anterior to the tendon. Needling, vertically 0.5 to 1 June. Caution, reducing needle techniques contraindicated during pregnancy. Exception, a supportive point during labor. If the patient has cold feet, the therapeutic effect can be increased by using a heat lamp or a hot cherry pit bag under the soles of the feet. Actions, indications. Bladder 60 clears heat, subdues yang and wind, and eliminates excess, especially in the head. Opens the channel, alleviates pain, relaxes the tendons, strengthens the lumbar region, promotes labor. Special features, Jing River Point, Fire Point, Madanyang Heavenly Star Point, important distal point for the cervical, thoracic, and lumbar spine, especially for chronic cases. Bladder 60 clears heat for feeling of heat in the head, redness, pain, and swelling of the eye, bursting eye pain, nosebleed. Extinguishes anterior wind and subdues rebellious chi from the head. For epilepsy, lockjaw, headache, dizziness. Removes obstructions from the channel for stiff neck, backache, upper backache, sciatica. Strengthens the back for chronic lower backache. Invigorates blood and promotes labor, difficult labor, retention of placenta. Bladder 60 has a wide range of action. Firstly, it is very much used as a distal point in the treatment of backache. It differs from bladder 40 insofar as it is better for chronic rather than acute backache, and better for backache of deficiency rather than excess type. Its sphere of influence extends to the shoulders, neck, and occiput, unlike bladder 40, and is therefore much used for painful obstruction syndrome of the shoulder, neck, and head. This is also due to its effect in eliminating wind, exterior or interior, which normally attacks the top part of the body. It also extinguishes internal wind and treats tremors of the legs. Owing to its sphere of action being on the occiput and head, it is very much used as a distal point for headaches deriving from kidney deficiency, particularly deficiency of kidney yin. Bladder 60 is also effective to clear internal heat from the bladder channel, affecting the eyes and nose. The empirical use of bladder 60 for difficult labor is well established, and this means that it is a point forbidden during pregnancy. Its name is probably because the Kunlun Mountains in Sichuan are where the source of the Yangtze River is located. The bladder channel is the longest channel of the body, just like the Yangtze River is the longest in China. And the point is near the prominence of the external malleolus, which could be compared to the Kunlun Mountains. Bladder 60 is the far point of the Taiyang bladder channel and an important point to clear and descend excess wind, fire, and yang from the upper part of the body. To best understand the actions of this point, 3 factors should be taken into account. As a fire point, bladder 60 is able to clear heat, fire, and excess yang. Taiyang Supreme Yang channel is the most yang of the 6 channels. Bladder 60 is located on the foot towards the inferior end of the bladder channel, which traverses the entire posterior yang portion of the body. Kunlun, as the fire point on the water meridian, can help regulate the fire aspect of the bladder. As with every other official, in order to be able to carry out its responsibilities, the bladder needs to have sufficient purity, vitality, and an equable temperature. Too sluggish and hot can render the bladder dried up and toxic. Could not only make one physically cold but also tense and contracted. Communication can become staccato, intense, or withdrawn. If the person lacks the yang energy of fire to do anything but stagnate and sink into despair, here you can bring the vitality, expansiveness, and illumination of fire to purify and brighten their outlook. Fire is about purification. If this combines with the cleansing power of water, the illumination and maturity of fire mingling with the wisdom of water, it is a powerful combination for the mind and spirit, bringing development and insight. The point is named for the similarity of the external malleolus near where it is located to the appearance of a mountain. Thank you for your attention.
Let's discuss the heart channel, divergent channel. Pathway. The heart divergent channel separates from the heart primary channel at heart 1 in the axilla, penetrates the thorax at GB22 on mid-axillary line and 3 tune distal to the axilla, and reaches the heart. It then ascends to the neck and crosses REN 23, disperses in the cheek and reaches the medial canthus of the eye at bladder 1, where according to most authors, it connects with small branch coming from SI18 to form one of the 6 confluences. Here, SI bladder as 4th confluence. Commentary according to Solinas et al., the heart divergent channel meets the small intestine divergent channel and the small intestine primary channel at the heart in order to bind with one of the 6 confluences. Clinical importance strengthens the relationship between the heart and the thoracic region. Points of the heart primary channel mainly treat disorders of the heart and the thorax. There is no connection with small intestine. Connects the heart primary channel with the neck. Points on the heart primary channel can be used to treat disorders of the throat and vocal cords such as laryngitis, pharyngitis, etc. Use points such as heart 5, heart 8. Strengthens the connection between the heart and the inner canthus of the eye. Heart points can thus be used for disorders of the eyes. The heart divergent channel separates from the primary channel at the axillary fossa, enters the chest, connects with the heart, ascends along the throat, emerges on the face, connecting with the small intestine channel at the inner canthus. The heart channel of the hand Xiaoyin is exteriorly coupled with the small intestine channel and paired with the kidney channel of foot Xiaoyin according to the 6-channel theory. The heart-small intestine relationship is further strengthened by the fact that the heart primary channel connects with the small intestine Fu. The heart divergent channel connects with the small intestine channel at the inner canthus. The heart-Lu connecting channel meets with the small intestine primary channel. In addition, it is important to note that a branch of the heart primary channel ascends alongside the esophagus. A branch of the heart primary channel connects with the tissue surrounding the eye. The heart divergent channel ascends to the inner canthus, and the heart-Lu connecting channel ascends to the eye. The heart divergent channel emerges on the face. The heart-Lu connecting channel ascends to the root of the tongue. Thank you for your attention.
Now let's talk about the heavenly star points of Madanyam, LI11 and LI4. LI11, Chi-Chu, location with the elbow flexed on the lateral end of the elbow crease in a depression between the end of the crease and the lateral epicondyle of the humerus on the extensor carpi radialis longus muscle. How to find? First, with the elbow completely flexed, locate the lateral end of the elbow crease. Next, with the elbow flexed at approximately 90 degrees, palpate for a pressure-sensitive depression in this area on the extensor carpi radialis longus muscle. LI11 is located close to the border of the proximal aspect of the ulna. Also located at the level of the elbow crease are lung 5, P3, radial ulnar of the tendon of the biceps, and Part 3, with the elbow completely flexed at the medial end of the cubital crease. Needling vertically 1 to 1.5 Sun. Actions, indications, clears heat, expels wind, clears Yiming fire, cools the blood, drains dampness, alleviates itching, opens the channel. Special features, Hulsi point, earth point, tonification point, Sun Si Miao ghost point, Madanyang heavenly star point, important point for heat conditions and disorders of the upper extremity. Earth point, tonification point, Hulsi, antique autumn point, ghost point, Madanyang heavenly star point, mental precision point. This valuable tonification point can strongly invigorate the meridian. It can be considered for problems in the face, for example, eye disorders, especially when accompanied by extreme redness and pain, earache, toothache, along with LI4 and LI7, bronchitis, and hay fever. This point may be effective in cases of chronic constipation. Excellent for bringing stability to the LI. It's the earth point. Consider this point before releasing the internal dragons. If a degree of possession is suspected, it is a ghost point for problems of the shoulder, upper arm, and forearm. Crooked pan cools blood heat and can be used when there is heat in the blood affecting the skin, as in some types of psoriasis. LI11 is frequently combined with LI4 and DU14 in acute fever and situations of fire poison, boils, and throat swelling with heat. It can help clear interior heat from any organ. Being a Hulsi point, it allows qi to drain from the meridians into the organs. Hulsi points can be used to supplement, tonify, or drain and disperse qi. Expels exterior wind and is often used in later stages of wind heat. Resolves dampness and is useful for resolving damp heat. Used for masses in the back and upper body. Used for thyroid goiter, considered a form of phlegm. Benefits the sinews and joints. Hulsi points are used to smooth the flow of qi and blood in the meridian, as well as dislodge pain and pathogens in the joints, and so are good for joint pain. LI4, joining volley. Location on the radial aspect of the hand between the first and second metacarpal bones, closer to the second metacarpal bone and approximately at its midpoint. How to find? When pressing the thumb and index finger together, the adductor pollicis and the interosseous dorsalis muscles will form a bulge. Needle LI4 at the highest point of the bulge and push it further towards the inferior aspect of the second metacarpal bone. Or spread the thumb and forefinger and place the distal phalanx of the thumb of the other hand on the webbed border. When flexing the thumb, its tip will point to LI4, or insertion on the angle bisector between the first and second metacarpal bones, needling in the direction of the midpoint of the second metacarpal bone. LI4 is needled 0.5 to 1 Sun vertically or slightly obliquely towards the palmar aspect of the hand. Caution: reducing needle techniques are contraindicated during pregnancy, exception to induced labor. Actions, indications of LI4. Releases the exterior. This is the main point. Regulates the face and head, regulates the defensive qi, wei qi, and sweating. Opens the channel and luo connecting vessels. Alleviates pain, promotes labor. Special features: Yuan source point, Kao Wu command point for the head and mouth, Madanyang heavenly star point, entry point according to some authors. The most important analgesic point for the whole body. Most important single distal point for disorders of the face and sensory organs. It is the most commonly used point in clinical practice. The combined bilateral needling of LI4 and liver 3 between the second and third metatarsal bones is known as four gates. They strongly regulate the qi and blood, stop pain, and relieve spasms. LI4 expels exterior wind, colds, upper respiratory infections, and influenza beginning stages. Regulates sweating, benefits eyes, ears, nose, and mouth. Distal point for all problems of the face, combined with liver 3, the four gates to expel exterior wind, extinguish interior wind, and calm the mind. Regulates ascending, descending of qi, hence subdues rebellious qi in the head. Good for allergic rhinitis. Empirical point to promote labor, calms the mind, forbidden in pregnancy. Thank you for your attention.
Let's discuss the Sun Si Miao ghost point. Bladder 62, Shen Mai, extending vessel. Location in a depression directly inferior to the highest prominence of the lateral malleolus above the joint space between the talus and calcaneus. How to find? First, locate the highest prominence of the lateral malleolus. Bladder 62 is located directly below it, in a depression inferior to the lower border of the malleolus and superior to the tendons of the peroneus muscle in a joint space between the talus and calcaneus. Needling vertically or obliquely 0.3 to 0.5 June. The needle may reach the calcaneofibular ligaments superior to the tendons of the peroneus longus and brevis muscles, possibly also the joint space. Actions indications: subdue external wind, clears heat from the head, calms the shen, benefits the head and eyes. Expel external wind, opens and regulates the yang qiao mai, opens the channel, alleviates pain, moves the qi in the bladder sinew channel. Special features: opening, master point of the yang qiao mai, sun si miao ghost point. Removes obstruction from the channel, stiff neck, occipital headache, stiff back, cold, painful obstruction syndrome, B syndrome of the neck, pain in the legs. Benefits the eyes in insomnia, somnolence, red eyes, eye pain. It opens the yang stepping vessel and harmonizes left and right in the yang stepping vessels. In imbalances between the left and right. One leg longer than the other, one scrupula higher than the other, sweating on one side of the body, hemiplegia, etc. Excessive yang in the head. Extinguishes interior wind in epilepsy, attacks in daytime, opistotonus, lockjaw, tremors, wind stroke, deviation of the eye and mouth. Subdues rebellious qi from the head in headache, dizziness. Expels exterior wind in aversion to cold, fever, occipital headache, and stiffness. It also calms the mind in manic behavior and insomnia. Bladder 62's action is mostly due to its being the opening and beginning point of the yang stepping vessel. This vessel controls movement and agility, and this point can be used in chronic backache in a similar way to bladder 59. Bladder 62 also relaxes the tendons and muscles of the outer leg and is used when the muscles of the outer leg are tense and those of the inner aspect of the leg are relaxed. The yang stepping vessel flows up to the eye and meets the yin stepping vessel at bladder 1. The yang stepping vessel brings yang energy and the yin stepping vessel brings yin energy to the eyes. The spiritual axis in chapter 17 says the yin stepping vessel branches off from the kidney channel at kidney 2. It travels upward, reaching the inner canthus of the eye. Here it meets with the yang stepping vessel. When the yin and yang stepping vessels are harmonized, the eyes will be moistened. When the energy of the yin stepping vessel is deficient, the eyes will not be able to close. As was mentioned before, bladder 62 can be used in combination with kidney 6 for the treatment of insomnia, in which case bladder 62 is reduced and kidney 6 reinforced, and vice versa for somnolence. Besides its effect on the eye, the bladder 62 influences the spine and brain and eliminates interior wind and is therefore used in the treatment of epilepsy, but only if the attack occurs mostly in daytime. If the attacks occur at night, kidney 6 would be used. As the yin and yang stepping vessel harmonizes left and right of the yin and yang channel respectively, bladder 62 can be used to harmonize left and right of the yang channel, such as in one leg longer than the other, one scrupula higher than the other, sweating on one side of the body, hemiplegia, etc. Comes the sleep point, opening point of yang qiao mai, heel vessel, coupled point of du mai, ghost point. This point can have a powerful energizing effect on a deficient water official. Used for reinforcing other bladder points, has a direct effect on the endocrine system, can be sedated for pain relief, can also be used for mental level problems together with kidney 6. Opening point of Yin Chiao Mai, especially for insomnia, mania, or extreme fear. Under its alternative name, Ghost Path, Bladder 62 has included in a group known as the 13 Ghost Points, listed by Sun Si Miao for the treatment of epilepsy and mania. Bladder 62 is further indicated for disorders of the heart and spirit such as palpitation, insomnia, and mania depression. Thank you for your attention.
Now let's discuss a pattern for constipation, qi deficiency. Clinical manifestations: desire to open the bowels, but difficulty in doing so. Great effort to open bowels, feeling of exhaustion afterwards, thin and long stools which are not dry, pale complexion, tiredness. Tongue is pale, pulse empty. This pattern is due to either spleen or lung qi deficiency or both. If there is spleen deficiency, there will also be muscular weakness and poor appetite. If there is lung deficiency, there will be slight shortness of breath and a weak voice. The constipation here is due to spleen qi deficiency, not moving the stools in the intestines, or to deficient lung qi, not providing enough qi to the large intestine for the effort of defecation. The latter situation is common in old people, women after childbirth, or anyone after a long, severe illness. Treatment principle: tonify qi and moisten the intestines. Points: bladder 21, bladder 25, spleen 15, stomach 36, spleen 6, ren 6, lung 7, bladder 13. Reinforcing method: bladder 21 tonifies stomach qi and is chosen also because, due to the descending movement of stomach qi, it will stimulate the bowel movement. Bladder 25, back transporting point of the large intestine, stimulates the bowel movement. Spleen 15 stimulates the bowel movement. Stomach 36 and spleen 6 tonify qi and promote the bowel movement. Ren 6 tonifies qi in the lower burner. Lung 7 and bladder 13 are used to tonify lung qi in cases of lung qi deficiency. Thank you for your attention.